Teething in swim lessons. Let's talk about it. In the self-rescue community, some of us, not all, take children as young as 6 months as long as they're sitting independently for 1 minute. Now, working with children within this age group, teething is very much at play for developmental milestones and just something we expect as instructors. Now, let's first break apart the signs of teething, right? We have irritability. They're not sleeping as well at night. Sometimes their body temperature fluctuates. Sometimes they're just darn right grumpy, right? Also, for some kids, when they're getting teeth in, it doesn't just affect the gum in which the tooth is about to erupt. Sometimes the muscles in their face are sore, right? So their cheeks, the muscles on their the floor of their mouth, their tongue, their neck, it affects the way that they rotate their head. So because of those circumstances, some children are going to struggle rotating their head when working on their rollback in lessons. I'm going to share a personal experience that just happened last year. I had a student who was 10 months old, and he was getting probably 6 to 8 teeth in at one time. Canine to canine on the top, and then he was getting his lower bilaterals on the bottom. He was really struggling through lessons. You could tell that he was very sore. He was very cranky. He was struggling with getting enough sleep. His BUDS questions indicated clear signs of teething. I had recommended to mom that we take a break for lessons and that we give them a chance to work those teeth through and give them a chance to break through. So in that way, working on swim isn't so hard. So there are times where it will be recommended for you to take a break. If the child is struggling and the instructor is proposing a break, it's for your child's benefit. And I have talked to parents where they absolutely did not want to take a break. And honestly, it's at the expense of the child. Let them have the break. Again, they're learning a really large skill set, one of the largest ones they will learn next to walking or talking. So if your instructor is recommending this, it's not to say that your child cannot do something. It just means that developmentally, they're going through a lot, and swim on top of that is just overwhelming them. So have conversations with your instructors, be honest, be realistic. But the question of the matter is, do lessons get paused for teething sometimes? The answer is yes. Hopefully I answered your questions.